Hi everyone, I'm Anise and I'm here today to talk to you all about the importance of promoting self-care during the residency period and new nurses. As a brief introduction, I wanted to start off by talking about the definition of self-care. I do have two definitions over here. First definition I have is that self-care is a very active and powerful choice to engage in the activities that are required to gain or maintain an optimal level of overall health. Second definition is that self care includes activities and practices that we can engage in on a regular basis to reduce stress and maintain and enhance our short and longer term health and well being. Based on these two definitions, I believe we can agree that self care is a choice of something that we engage in at least on a somewhat regular basis. And we do it with the purpose of promoting our own personal health and well being. As you can see over here from the 7 pillars of self-care, there's numerous categories of self-care. Most of these categories are related to either physical health, mental health, or spiritual health. So, what is the problem relating to self-care? In order to look at this problem, we need to agree that there are numerous stressors in nursing. The CDC developed a list of stressors in healthcare workers. These stressors include work overload, long hours, sleep deprivation, understaffing, exposure to infectious diseases, among many others. If you look over here at this bar graph, RN Network did a study and they asked nurses, how has your workload impacted your mental health? As you can see there, a majority of nurses responded that their workload negatively impacted their mental health. So, looking back at that question relating to self care, what can we do to counteract these stressors inherent in the nursing profession? And I believe that through the promotion of self care, we can counteract some of these difficulties relating to nursing. So, the true problem is that there is a lack of promotion or lack of education surrounding self care in the nursing education system, as well as the residency programs that educate new nurses. Now, I do understand that training a new graduate nurse can be very expensive. The NSI approximated that training a new nurse costs around $44,000. That is a lot of money, especially when you look at the fact that healthcare is a business. So, when it comes down to it, every hour during this training period is going to matter. However, coming from a more clinical side rather than the business side, I do believe that nursing is more than a business. Nurses are trained to look at their patients in a holistic manner. And when you pour your heart into your profession, it does come along with some of those workload stressors that we talked about before. Because of this, I believe that self-care should be developed into residency programs. And it should be a part of these residency programs so that we can teach nurses early that self-care is important. Self-care can be described as the first element in any nursing theory, any caring model, or healing practice. When you look at it this way, it can be understood that if nurses are not caring for themselves, they're not going to adequately be able to care for their patients. Self-care is not going to take a lot of time to teach. I would say around an hour of time should be enough to talk about the importance of self-care and include in the residency program kind of a plan of care for self-care. Here's a quick video that I found relating to self-care in nurses. So ultimately, what is a hospital going to get out of nurses practicing self care? So we've already established that self care decreases stress. So when we talk about decreasing stress, we are also talking about decreasing the risk of burnout. We're talking about increased productivity, and we're talking about improved retention rates. All of these are extremely important to any business, um, and especially important to any healthcare business, because we all know that there is a shortage of nurses. And so, what it comes down to is that when we have happier and healthier nurses, we're going to have happier and healthier patients. Thank y'all for watching my video. I hope that you got something out of my presentation. Feel free to leave any questions or comments below or reach out to me. Thank you again for watching.